so just tell me when to go.
Go ahead.
Good morning, everyone. My name is Teresa Gooden. I'm with Anthem Blue Cross and Blue Shield, and I am here today to talk about the WiseChoice Healthcare Alliance program for small group businesses. I would like to thank Alec Burnett, who's the president of the Fauquier Chamber of Commerce, for inviting us here today to talk about this new program. We also have some wonderful insurance brokers with us today that I will introduce at the end of my presentation. Some of you know that a lot of time has gone into this program, and the Virginia Chamber of Commerce has been focused on strategies to support local businesses and to address their needs to attract top talent and to invest in the local workforce. This benefit package for an employer, what a benefit. The benefit package that an employer offers is an extremely important part of the total compensation that a small group business can offer to their employees to help retain and to attract new talent. It is the goal of this program to partner with the business community in delivering competitive benefits, leveraging Anthem's national provider networks and industry-leading digital tools. So what is WiseChoice, and how did WiseChoice come about? Great questions. Chamber Solutions is a wholly owned subsidiary of the Virginia Chamber of Commerce, and they have more than 30 years of experience in employee benefits and partnerships with local chambers throughout Virginia. They created the WiseChoice Healthcare Alliance program, and this program is a collective of businesses and community leaders that have come together to help small groups in Virginia drive healthcare engagement and health literacy that hopefully will lead to improved health and in turn lower healthcare costs. The WiseChoice Healthcare Alliance was created for the purpose of offering employer-based healthcare plans to members of affiliated local chambers and associations. The Alliance offers a self-funded employee welfare benefit plan to eligible employer groups that have between 2 to 50 employees. The Alliance has partnered with Anthem to provide stop-loss protection and a portfolio of healthcare benefit options labeled WiseChoice Healthcare Alliance. The program has been granted operating authority and is regulated by the Virginia Bureau of Insurance with the Department of Labor oversight. The Alliance is governed by trustees that represent the interest of participating members. You don't have to do it alone, slide. This provides a unique opportunity for small employer groups to engage with health benefits in a way similar to one large employer group as a self-funded multiple employer welfare arrangement that stands for MEWA. The Affordable Care Act plan restrictions, the ACA plan restrictions, do not apply to the WiseChoice Healthcare Alliance program, such as metal levels or actuarial value requirements. Again, the WiseChoice Healthcare program is a solution for a small business looking to benefit from medically underwritten rates but may not want to go it alone in an alternative funded product. And again, this program is available to groups that have between 2 to 50 employees. Okay, so the next slide is the WiseChoice Healthcare Alliance with the who, what, and why. And the WiseChoice Healthcare Alliance did establish a trust that administers their own healthcare plans and is contracted with Anthem as a part of an administrative services only agreement. Some of you may have heard ASO. WiseChoice is a self-funded employee welfare benefit plan. So again, small group businesses coming together to be a large group to share overall claims risk and enjoy lower cost, providing comprehensive benefits to employees. So what are the benefits, the big benefits for small businesses? You can see the benefits on this slide. Underwritten rates for small groups may translate to lower cost rates, depending on the health of the group. Flexible benefits. Employers will have many plans to select from. We have 146 plans. And groups between the size of 2 to 9 can offer up to 4 plans, and groups that have 10 or more employees can offer up to 6 plans. So there's a lot of plans to select from, and that's where the flexibility comes in. Stable cost. Employers will pay a fixed monthly payment each month. Anthem provides the stop-loss coverage. When small groups also purchase our dental and our vision plan, it can actually lower the medical cost by providing a medical discount, and I'll talk about that in just a few minutes. And again, Anthem, Blue Cross and Blue Shield, we have the largest provider networks in Virginia. Now I'd like to go to the slide where it talks about elevating the member experience with our digital first. Thank you, Greg. So when you become a member of Anthem, the member should download our Sydney Health app to their smartphone. Members can navigate all of their health care right from their phone. And take it from me, I'm not really good at apps. I'm a little older, don't have children to rely on to help me with apps. But I will say, we introduced the Sydney Health app many years ago, and it wins awards every year. I have a work cell phone and a personal cell phone, and the Sydney Health app is downloaded to both phones. And that's how I navigate my health care. I can look up my claims, I can look up my prescriptions, I can manage my prescriptions, I can chat with an Anthem member service rep from my phone, from my Sydney app. I can actually text with a medical provider from my Sydney app. I can have face-to-face doctor visits, all from my Sydney app. There are so many things you can do on this app. It really provides a great experience to the member, and it's so easy. The next slide is on our Anthem Whole Health Connection, and again, I mentioned this earlier. When a small group offers Anthem's dental and vision programs, we are able to discount the medical premium up to 2%. So really, Anthem's Whole Health Connection, it connects all the dots when a small group offers all of these lines of benefits together. It allows the doctor to get a complete view of the member's health. For instance, when I go visit a dentist or my vision provider, they can actually diagnose medical conditions within my body through the mouth or through the eyes. And our systems talk to one another. So if I'm meeting with my vision provider and he can detect diabetes just by looking through my eyes, he or she will make a note of that in my health records, and then my primary care physician will have access to those notes. So that's why adding dental and vision is important, because it gives the doctor a full view of the member's health. And so in conclusion, this program, find out more and get started, this program is sold through your insurance broker. All brokers must be certified to quote this program for you and to sell this program. And certification means that your insurance agent has gone through training with Anthem. So it's important that your insurance agent is appointed with Anthem to sell small group business and has gone through the certification so they can talk to you about this program. And with me today, we have 3 insurance brokers who are based right here in Warrenton, Virginia. And I would like to call all 3 up to the stage so you can meet them. We have Priscilla Hotto of Hotto and Associates, and Priscilla is also a member of the board for Fauquier County Chamber.
That's correct.
And then we have Virginia Ward, who works alongside with Priscilla Hotto and Hotto and Associates. And then we have Matt Eastham, who also is an insurance broker right here in Warrenton, Virginia. And I will let each of them say a few words, and I appreciate your time today. Thank you.
Thank you, Teresa, and we are glad to be here. Thank you, Alec, for setting this up. I am Priscilla Hoddle. I'm the president and CEO of Hoddle and Associates, and we are pleased to be here to help explain this new program today with our longtime partner, Anthem. We've done business together many, many years. Hoddle and Associates is located on Main Street in Warrenton, and I'm going to turn it over to Virginia Ward of my office, who oversees our employee benefits division, and she is our certified designee at Hoddle that can provide proposals for you in the WiseChoice plan. Virginia?
Thank you, Priscilla. Good morning, everyone. As Priscilla said, I am Virginia Ward, and I work with her at Hoddle and Associates. And I actually ran a preview of what our personal office plan would look like on WiseChoice. And I will say, right from the start, there is a significant savings that we can look at. Now, there are factors that we have to do. We still have to go through the underwriting phase of it because we are a under 10 employee group. But for right now, it looks like there's some savings that can be had, and it's certainly something that everyone should take a look at. Thank you.
And now we have Matt Easton. Matt?
Yes, thank you. My name is Matt Easton. I'm with Car and Hyde Insurance on Culpeper Street in Warrenton. Been there for, I guess, quite some time. Some call me a lifer for various reasons. I'm also appointed to sell this new product with Anthem to any chamber member. It's very much worth at least looking at to see if it makes sense for your group. As mentioned, there are factors that go into it, but it's definitely worth looking into to see if it makes sense for you. I'm happy to help. Give me a buzz.
Thank you. I just want to say one other thing. The WiseChoice Healthcare Alliance program is not for all small groups. Each group is looked upon on their own initially. And what that means is each group, we look at the demographics, the SIC code, the age sex factor, and the health factor of your group. That will determine your final rates. So I just wanted to let you know that this WiseChoice program is a wonderful program for small groups, but it's not for all groups. So thank you so much for your time. And with that, it's a wrap.